is a very valuable use of his time, and so we're really very pleased that he can do that, and to all of the speakers. So, so you saw Bobby talk about some very sort of medical device kind of oriented applications, and also hospital-related application. We've seen Patrick talk about a healthcare service delivery kind of application. We're now going to move to one of the other quadrants of Ben's matrix that he showed earlier. And for that, we're going to invite Nima Gardideh. I hope I pronounced that correctly. Nima serves as CTO of Venio and brings a formidable background in computer science, engineering, and product management. His first project was building an analog clock on his computer when he was 8 years old, and he's older than that now. And he's been at it ever since. His work as a project manager, he has worked as a project manager at Extreme Labs and went on to University of Toronto Computer Science, and I'll let him talk to us about what his application is. So please welcome Nima Gardideh.
Before I talk about Venio and how we're trying to simplify nutrition, I'd like to talk a bit about myself and what my background is and why I've gotten where I am today. So, as was mentioned before, my background is computer science, so pretty tech savvy. I've been in student governments before, done a bunch of product management, engineering stuff at other companies like Extreme Labs, as Bobby mentioned, and that's exactly what I do now at Venio, as well as mostly project management and engineering. Throughout my journey, I've been non-profits, whether it was going to Ecuador to help out different communities, or helping children in Africa, or even within Toronto, helping out students find jobs within different sectors. So that's sort of the reason I'm here, is to try to help as much as I can, and help people and help my family and my friends' families. And usually I like to talk in a sense of a story, and talk about where I am and why I'm here. But today I'm not going to do that. I'm going to do something that we do a lot in the company, which is we let the data speak for itself. So I'm going to show you a few stats that are just happening around the world right now, specifically in North America, so we can just see why we are where the market is at. So we're sort of looking at a problem in the world right now. A problem that 85% of people sort of don't know how much they're supposed to be eating day after day. And 40% of the caloric intake they have is all from added sugars or saturated and trans fats. And it's been estimated that in less than 2 years, 4 out of 5 people are going to be overweight and obese. And we like to joke around and say that we fixed the world hunger because clearly it's coming back at us and doing the opposite effect, because 65% of the world's population live in a country that more people die of obesity than they do of hunger. So those are sort of some trends that are happening within our lives, within North America specifically. And it's not just obesity and being overweight and all those things. It's also diseases, right? So currently, there's a study that shows 1 of 2 Americans have at least one or more chronic disease. And this is whether cancer, things like epilepsy, cardiovascular diseases, some of which can be prevented and really taken care of by diet, exercise, or having less alcohol, tobacco. So these are sort of the problems that have been happening, and they're only going to get worse in the next few years. And we see it as an opportunity to come in and really help people understand. Some of these issues are related to just lack of knowledge, or just lack of behavioral change in sort of, this sort of population that's living in North America. And before I go into solutions, I like to step back and look at what's happening because of the stuff that's going on. So, like 72% of people are now, they've realized this is a problem. They want to start becoming healthier, so they're starting to search online about solutions and information about health. So that's happening, and 57% of people who are doing that stuff already believe that they can solve their issues by using whether a tool on mobile or a tool online to fix their issues, whether it is nutritional, exercise, whatever it is. And there's reports showing that a lot of people are using health apps on their phones Bobby asked you guys how people have one on their cell phone. I mean, I'm wearing one of those devices right on my arm. Right? We're all starting tracking the things we're doing, what we're eating, how we're exercising. And 70% of smartphone owners have already started tracking one health indicator, whether it's nutrition, sleep, or fitness or exercise. So that's where people are, and they're sort of are uneducated. They come in and they trust all these companies to help them with what they're doing. So and there's a lot of noise. And the market is definitely fragmented from standpoint of who's coming into play and trying to really win a percentage of the market. There's a lot of people around, different sort of exercises. Diet is a big one, and then people are doing mental health, sleep, and stuff. And I'll go into a couple of examples of how they're doing it. Diet is mostly around tracking. Some are doing content delivery now. Cardio specifically is definitely a lot of tracking, like bands like Naki Fuel, Plus Band, the job one up that I'm wearing right now, and then the Fitbit that was mentioned earlier. All these different devices that attach themselves to you and start tracking what you do in order to help you figure out what you're doing wrong, which work pretty well for the kind of people who are already, whether fitness enthusiasts or just really excited about data. I love data, so I'm just wearing this, and in the morning I wake up and look at how I slept, and if my girlfriend's over, I show her I didn't sleep as well when you were around, and then just like, it's around. So those are just, that's why I'm wearing this. There's like no other reason I'm doing this. I'm pretty well educated on how to be healthy. I don't need this device, but I'm wearing it because it's cool. And a lot of people are doing exactly that. The Nike Fuel Band, they're just showing it off that they're doing it. There's not a lot of success stories as to someone who is not ready to change their lifestyle, buying one of these bands and changing their life. It's mostly behavioral issues that people have to deal with. So yeah, the market is fragmented. There's no clear winner as to whether it's diet or fitness or anything like that. And there's companies like Up that I just, so this is the band that I'm wearing, this is the Up part. You can see how well you're eating, how well you're exercising, and how well you're sleeping. And then there's companies like Lyft, which John and I, the CEO, is sitting right over there, a big fan of, because they've realized that the issue is habitual, so they come in and try to change your habits overall. So they have things like, I want to exercise today, or I want to bike to work today. Try to make sure you track those things so you realize if you were working really hard last week, what did you not do well? And then look at the data and maybe change your behavior. And this is still back to the same issues that we're tracking things here. But talking about that stuff, it's these people are trying to get you to track things and really help you get healthier. But the biggest issue isn't that we don't know what to track. It's that we don't know what we're trying to solve. We're trying to solve the wrong problem. And the problem is that no one really knows what health is, or what health really means. And that's why I think we got to be starting to define health for ourselves. Health is very relative, it's very personal, and it means different in different situations, and different things in different situations. So you've got let's say a very high intensive carbohydrate diet. It makes a lot of sense for someone who's running a marathon. It's a necessity for their success. But if someone with diabetes has it, it can be fatal. So health is relative. It's different per person and per individual. There's different variables even for one individual. They might be wanting to lose fat, gain weight, or lower their cholesterol, have less sugar because they're diabetic, and all these different things. And there's a lot of information out there, but it's all scattered and it's not really centralized. And no one knows who to trust anymore. And that's one of the reasons I think regulations are good, because there's people coming in with all these different sort of diets right now, and you don't know who to trust. Because some of them are we like to categorize them here. The top 5 diets, these are very scientific, done in intense studies in order to show the testimonials and the results before they actually popularize them. And then there's these ones who are based on mostly philosophy and just extreme opinions on whether diets or so you can see. Yeah. So like example, like the paleo diet, which is going crazy right it's not really based on science. It's more like saying, hey, 100 years ago, sort of people ate this way, they were healthier, so we should try that. It's not really science, right? So there's all these different things happening, and people really don't know what to do. And that's where we see ourselves come in, is really trying to educate people. And we're basing it on nutrition and trying to simplify nutrition because that 75% of your health is really based on your diet and how you eat. And you can see the trend of delivering content in the past couple of years, and it's increased exponentially, 134% growth in content delivery, and that's where we see ourselves being, is delivering specific content to people. So we see ourselves as content curators for people with ailments and allergies and all those different things. So if you're diabetic and you need recipes to cook, you can come to us. If you're celiac and you need recipes to cook, you can come to us. And we really just see ourselves as a content delivery mechanism. And we're trying to be proactive as versus the other guys. We're trying to track things and be reactive to what you've already done and really be there before you make the wrong decisions and have you deliver the right content to you in order to help you not get to a point that you have to look back and say, oh, damn it, I screwed up last week. And that's where we see ourselves. So far, what we've done is we have an app on the App Store. We're on web doing a bunch of things around discovery recipes, and we're just trying to move forward with that app. And I'd like to talk about like what could happen in this industry, which is things that we've sort of picked up in the past few months that we've been around. Who knows what big data is? Right, so just to give you a quick thing. So big data is basically making decisions and understanding patterns with a lot of data that you might have in a certain industry or certain sector. You talked about clinical analysis over the data that you're getting from your patients. So, they can probably say, okay, if a person is like 45 and they have this kind of disease, this is the sort of runway they have. They're gone because they have so much data on so many different people in the world. And this stuff is already happening. Big data in health is happening. There was a study recently released, actually on Monday, about artificial intelligence being able to make better decisions than a doctor after looking at the data the doctor collected from the patient. And it was less costly and it was better for the patient. And in a smaller amount of time. So big data is really big in health, and I like to see things happening in that industry more. And you guys have mentioned the problems can be slow, and it's going to take years, but if it happens, I think the way we see healthcare is going to change. And health professionals using technology is a great example with eShift. There's quite a few out there as well, trying to really change the way doctors work or dietitians work or personal trainers work. And some of the problems we've had to deal with in the past few months has been really sourcing all this data, understanding what nutrition really means and what exercising really means. So I think there's a big opportunity in coming in and really collecting all that data, whether it is nutritional information about all the ingredients in the world, the recipes in the world, whatever it is, and putting it together. There's massive, whether for-profit or not-for-profit opportunities over there. And we try to see ourselves as one of the few people who are just trying to knock on doors and grab that data in order for us to work with it. I'd like to end with really understanding this whole industry. Coming from the consumer side, obviously, there's a lot of enterprise talk here earlier tonight, and this is such a big industry that no one's going to be the biggest. Like, there's not going to be an Apple winning this industry. There's going to be multiple people having to work together and partner together in order to get to a place. And we really need to realize that and really work together. Thanks for having me.
Are there questions specifically for Nima?
A couple of questions around that. So how do you make sure that do you produce the content yourself, or how do you validate
So like I said, we're content curators. The content is generated for people who are diabetic. It's from the Canadian Diabetes Association, so the content comes from them. So it's already approved by the professionals. We just deliver it.
And how do you help people discover that content?
So we're on the web. We're trying to get on every platform and really tapping ourselves into the same organizations and getting their user bases to start using us in order to get to it. But we're also looking at enterprise angles to get employees using this stuff and see if that's a possible way for us. Pretty young company, so we don't know how it's going to work out.
Is focusing on any particular care?
Yeah, so right now we're looking at diabetes, celiac, that's why I mentioned them, celiacs, and hopefully pregnancy as well.
Do you collect any health data from like hospitals or stuff like that, or another people in addition to just the
Not yet.
I have a question myself, Joe. What is the? It's wonderful to have an altruistic and social value goal, but on the other hand, for that social value to be perpetuated, you have to be self-sustaining as a business. What's your business?
So we're obviously trying out a couple of different ones. So we have all this content from all these different associations and all these different bloggers around the world that they've trusted it to us. So we're trying to monetize on the content right now, and that's one of the ways we're doing it. And the other way is that we're trying to talk to insurance companies and see if we took this to the enterprise level. If a company ran with our product for a couple of years and we reduce costs, health costs for them, if the insurance companies would whether pay us to do that or reduce that company's payments, and we would be able to whether jump in and get cut of that or have the companies pay for this as a benefit.
And just as an example of that, I used to work for IBM, 400,000 people that they oversee either current employees or actually more than that, 500,000 people in terms of their retiree base. And we found at IBM that those kinds of interventions would pay 3, 4, 5 times whatever the dollar investment was. You get 3, 4, 5 times reduction in healthcare costs when the company is paying for the healthcare costs. So just as an example. Other questions? Okay, great. Thank you very much, Nima.